Hey everyone, this is lesson 2 of chapter 6, nutrition during lactation. So today what you're going to do is you'll watch this recorded lecture after you complete an assignment that I've posted to Moodle. So I want to draw your attention to this. I want you to go to Moodle, and let me pull that up right now. Go to Moodle and scroll down to this perceptions of breastfeeding online class activity. So this is a class activity that you'll complete during class time. You'll open this Google slideshow and you're gonna click through pictures that you see. There's 10 images, 10 slides that I want you to take a look at. And I'm realizing I just clicked out of Moodle. But you're gonna look at each of those images, and let me get back to that. Okay, so you're gonna look at each image and there is a thread for each image, and what I want you to do is discuss your initial thoughts or initial perceptions for each picture that you see. And once you post each of those, you'll go back to 2 of the photos and engage in a conversation that with one of your classmates based on what you both thought about the picture. So it's important that you go through each photo before you go try to post a reply, because it takes some time for your initial post to populate so that you can see your classmates. So after you post a perception or initial thought for each photo and then reply to 2 classmates, you'll work on your conclusion post. With that, you are going to answer these 2 questions. You're going to talk about what did your initial impressions of the images suggest about your own view on breastfeeding, and based on the perceptions that you and your classmates had, do you think society adequately supports breastfeeding moms? So if you haven't done that yet, I want you to stop this video and go back and work on that assignment, because that is due at 2:15, the end of class time, and it's worth 20 points. A few other reminders. There is your breastfeeding discussion forum, which is separate from today's class activity. That's been on your syllabus. It's worth 25 points. Your first case study is due on Wednesday night at midnight, and our first exam is coming up a week from today. So I just wanted to remind you of these things. If you have any questions, I'll be by my email and you can ask me those questions. So before we get started today, we're going to be talking about the benefits of breastfeeding as well as how we can offer support to breastfeeding moms. So I'm going to start with this video.
I'm Michelle Nagy, and I am a board-certified lactation consultant, so an IBCLC, International Board Certified Lactation Consultant. The American Academy of Breastfeeding Medicine recommends breastfeeding as long as the mother and child want to. The American Academy of Pediatrics recommends exclusive breastfeeding for 6 months, which means that a baby doesn't get any supplementation other than breast milk for the first 6 months. And at that point, that's when you would add supplementation in. Exclusive breastfeeding means that babies get breast milk only exclusively from the breast as long as they can. So it varies, again, for each mom, depending on how long she can take off from work and, what things she has to do as she goes back, how long a baby is exclusively breastfed. And that's different than exclusive breast milk feeding, which would be when she expresses and feeds her baby just breast milk, as well as nursing. Skin to skin is when a mom and baby are placed actually skin to skin. Baby will have on a diaper. Mom will not have any clothes on her upper part of her body. And we're actually trying to get the baby to get as much skin in contact with the mother as possible. So usually baby's lying the lengthways on mom's chest, head up on her chest, body down between her breasts and onto her abdomen. Babies relax when their feet touch mom's abdomen and thighs, and they're able to completely and feel secure right in that position. Skin to skin helps the brain to finish its development phases. It helps neurons to close and actually for the brain to grow. So skin to skin is absolutely an imperative thing that we are just currently researching and finding out more about. So the big push is to get babies skin to skin as soon as possible after delivery and to leave them skin to skin if you're breastfeeding until they feed. Allow them some sleep time away from mom, and then again back skin to skin until they get awake and nurse again, and you keep repeating that cycle until you've kind of got the whole breastfeeding dance, if you will, figured out. So skin to skin for every baby, absolutely an imperative thing and needs to be encouraged and promoted. They've discovered that 4 to 6 months down the road, babies that have spent time skin to skin with their mothers cry less, have less needs, can calm themselves better. And they're doing research now that says that these kids that were skin to skin with their mother have security as adults. They're more secure people. They end up in less trouble. There's a plethora of different things. So pretty amazing. There's things in breast milk that you'll never be able to put into formula. White blood cells, immunities, all of the things that will help your baby to overcome different disease processes, so many different things. And then for the mother, there's also benefits in that as well. Lower cancer, different kinds of cancers, lower chance for obesity, lower chance for developing diabetes herself. Some mothers are not able to breastfeed, and while the number statistic-wise is small for that, there are, again, a multitude of different options out there for her. Breast milk, her own breast milk, is going to be the very best for her baby. Second choice would be donor breast milk given through a donor milk bank, and we have one in Columbus. Dayton Children's has a site where we can get donor milk and where you can also donate donor milk. So that would be your second option. Third would be a formula choice, and that will be based on what the pediatrician feels is best, based on family allergies, family history, all of those kinds of things. When a physician is going to choose a feeding method, there are multiple things that they look at. And while yes, you can go to the store and you can buy X generic formula, is that the right thing for your baby? So it's really something that you want to discuss with your pediatrician. If you can afford to do donor milk, or donor milk is the best option for your baby, and they can write a prescription for it. It's like obtaining a prescription to get donor milk, and it is very expensive. But in some cases, especially low birth weight babies that are having a lot of difficulties with allergies, it may be the best choice for your baby. Here at the Atrium, after a woman has delivered her baby, the labor and delivery nurses are great at helping you get started initially. So they will help you get your baby skin to skin, and they will help you with the initial latch. And then usually lactation comes on board somewhere later the day that you deliver, or it could be early in the next morning. So part of my job is to also see inpatients, which would be a daily visit to any woman who's had a baby and is breastfeeding, or if there's a mom who's formula feeding that has questions about breast care or what's going to happen. I'm not breastfeeding my baby, so what can I expect? I certainly can go in and see those patients as well.
So that is a good video because it discusses some of the difficulties with breastfeeding, but things like skin to skin can really promote bonding between mom and baby that can really help breastfeeding. But also it highlights the importance of assistance from a lactation consultant. We'll talk a little bit more about baby-friendly hospitals that do practice skin to skin and how the lactation consultant kind of fits into this on Wednesday. But now we will move on to the overall benefits of breastfeeding. And remember, we already talked about the nutrient content or composition of breast milk, as well as the diet that moms ideally should consume while breastfeeding. So today we're going to talk more about the benefits of breastfeeding itself. So remember that there are tons of benefits to breastfeeding, and for that reason, human milk is the preferred food for healthy babies that are premature, and babies that are sick. So it's really important that we, as healthcare providers, are well educated about breastfeeding because there's lots of barriers, and if we can come in with support from all angles, it really can help mom to have success with breastfeeding. So if ever during this chapter you're thinking like, why in the world do I, who am going to be a PT or physical or occupational therapist or speech therapist, all of these things, like why is it important that I learn about nutrition during lactation? It's really about those barriers that your patients and your clients may experience, and how you in your future role can help them overcome those barriers. So as we said, there's lots of benefits, especially for mom who breastfeeds. There's hormonal benefits, there's physical benefits, and psychological benefits. So one of the interesting things about oxytocin is that not only is it involved with the letdown of milk, but it's also involved in contractions of the uterus after birth. So as oxytocin levels increase, and remember, the infant suckling at the breast is part of the reason that oxytocin would be increased. So each time mom breastfeeds, oxytocin is going to surge, and that helps to make the uterus contract or reduce in size and return to the size that it was pre-pregnancy. So that's super, super interesting, something that happens when moms breastfeed. Other physical benefits include a possible delay in ovulation. Of course, this is something that we don't want to teach moms to rely on as a method of birth control, but it is pretty interesting how this is sort of a defense mechanism for the mother's body, because she just did give birth, and it is supporting another life, aka her newborn. So it's a defense mode that her body is saying, okay, we're not going to ovulate because we're already supporting two people, and it would be very difficult for us to meet the needs of a third. So really interesting. We, again, don't want to teach moms to rely on this alone, on breastfeeding alone as a method of birth control. But for the most part, up to about 6 months, if the infant is completely 100% breastfed, ovulation may be delayed up to that period of time. There is the physical benefit of weight loss, but again, this is going to be very individualized and not something that we want to necessarily promote as a reason to breastfeed. One, because that puts body size at the front of the mom's mind, and right now that's really not what's the most pressing subject. We want mom to nourish her body, and we want her to be able to nourish the baby. So not so much want to focus on weight, but we do see that the long-term benefit of breastfeeding may be a reduction in obesity and the risk of obesity, as well as the risk of type 2 diabetes after she is out of that postpartum window. And then finally, there's the psychological benefits. Moms who breastfeed and are able to do so successfully tend to have greater self-confidence, and it does encourage that bonding with the infant. So skin to skin alone can help with bonding, but breastfeeding itself is really powerful to help increase that bond. And we know that oxytocin has a role in that as well. So dads can actually bond with their infant through skin to skin contact too. And that's one of those important pieces of what is a baby friendly hospital, because they're not just focusing on skin to skin with mom, but they also perform that activity between dad and baby as well. So the infant, of course, is going to have a lot of benefit, or experience a lot of benefit if they are breastfed as well. So, of course, we've talked about how breast milk is the optimal form of nutrition. It has a great balance of nutrients, and it's an isotonic solution. So that makes it really easy for the infant to digest. It means that they don't need additional fluid. And it means that they're getting a perfectly balanced diet for their specific point in life, so their age, as well as if they have any illness or condition. So infants who are breastfed are going to experience less indigestion, because it is just easier for the infant to digest compared to a formula. And again, it's going to have those great balances. And if mom's diet is well-rounded, it's going to have a lot of those omega-3 fatty acids that really help with brain development, cognition, as well as just general development for the child as well. So one of the really important things about the actual nutrient content of breast milk is that the bioavailability of those nutrients, especially minerals like iron, is so high. And with that, they're able to absorb and utilize those minerals more, but they're also not going to cause that digestive upset that maybe could occur from a formula. So on top of that, there's great immunological benefit because it does, breast milk does contain those antibodies and cytokines that help to support the infant's immune system. So it'll help to protect them from infections, diseases, and because of this, it will decrease the incidence of infant mortality. So infants who are breastfed are going to have fewer acute illnesses and less chronic illness later in life as well. So we're going to see a decreased risk in allergies, in asthmatic disease, decrease in things like eczema and psoriasis, ear infections, as well as celiac disease, IBS, and leukemia, which is a type of cancer. So tons of benefits related to the immune system and the function of the immune system for infants who are breastfed. So for breastfed infants, there's also some physical benefits, cognitive benefits, and also sort of how they adjust to life outside of the womb. We see that infants who are breastfed tend to less likely be overweight after or during childhood. We typically see that infants who are breastfed are leaner at 1 year, and that's going to continue typically. We see that infants who are breastfed have greater cognitive ability, and they have less pain during infancy. So things like colic, we don't see as much with breastfed infants. Part of that's going to be because the breast milk is so easily digested, and colic is so rooted in indigestion. But it also helps with pain as well. So on top of that, infants who are breastfed tend to require less medical care, and that translates to lower medical costs on top of not having to pay for formula. So financially, breastfeeding can be a great decision if mom is able to. So moving on to the process of breastfeeding, there's a lot of controversy, or women may think that they aren't able to produce enough to support their infant, and that may cause them to just give up as a whole. But we have to know that breast milk is based on supply and demand. So the amount of milk that we create is dependent on how many times that infant is going to feed a day, how active they are during that feeding. So are they vigorously drinking, or are they just kind of lackadaisically having a feeding? And also how much time the infant is at the breast. So remember, oxytocin and prolactin are stimulated, their release is stimulated by the infant suckling at the breast. So the infant has to feed for milk to be able to be produced and secreted. If the infant isn't feeding, then milk synthesis is going to decrease. So another question is, does the size of the breast factor into a woman's ability to nurse her infant? And the simple answer is absolutely not. It's not about the fat content of the breast, but that mammary gland structure that is going to be creating that milk and secreting it. So the rate of milk synthesis is going to vary between breasts and between feedings. So there may be some questions regarding how much milk is going to be created, but it really just comes down to how often that breast, that side, is going to be used, how vigorously the infant is consuming the milk, and how long the infant is suckling at the breast. So stimulating adequate milk may require 8 to 12 expressions or feedings per day. So on top of, let's see, like if you're breastfeeding and you want to pump, it may require a little bit more. So it's really about providing enough milk to the baby for breastfeeding times, but a lot of women find that they're able to pump 1 to 2 times a day in addition to their feedings. So another question women may have is if they had a breast reduction or breast augmentation surgery, are they able to breastfeed? And that just really depends on the type of surgery that they had. And not necessarily absolutely not, you can't breastfeed. It depends on how that surgery was conducted, how the surgeon manipulated the mammary glands. Some women kind of just have to wait and see if they're able to breastfeed, but many women who have these surgeries are able to breastfeed successfully. So the breastfeeding process starts by preparing the breast for breastfeeding. So it's encouraged to just offer like a gentle massage to kind of get things moving. A lot of times mom may suffer from something that's called mastitis, and that can make things painful. So what they can do is just like put a warm compress on, and that may help a little bit. But the big thing is we want mom and baby to both be comfortable and allow for a good latch. So the latch is one of the most important things, and that's what we're seeing here. This can cause a lot of pain if the latch isn't correct. So this is where a lactation consultant really comes into play and can really change the entire game for a mom, especially if they're new to breastfeeding. Because if that latch isn't appropriate, mom is going to be very uncomfortable. Baby may experience things like reflux. And it could be that baby has like a lip tie or a tongue tie that's preventing a good latch. So it's not all really mom's fault, but a lactation consultant can address all of those things. So we all have reflexes. Your doctor checks your one of your reflexes whenever he uses that tool between like your patella bones and your leg kicks out. Infants also have reflexes that help with breastfeeding. 2 of those are the oral search and the rooting reflex, and these are really what help to make that good latch. So the oral search is when they open their mouth really wide when they're close to mom's breast and they start to thrust their tongue forward. So that's going to allow for them to latch. But also this rooting reflex, especially whenever mom may like touch the infant's cheek on one side, they'll start to turn their head towards that side, and that's helps with latching as well. So it's really all about getting that good latch and good position to start with. So infants are very much able to express their hunger cues, but we just have to be able to understand them. So they obviously like can't tell us that they're hungry. And many people may think that crying is how they tell us they're hungry, but actually that's one of the late stages of hunger, or the late signs of hunger, and they give us lots of signs like bringing their hands to their mouth, sucking on their hands, moving their head from side to side. That's kind of like that rooting reflex. And then people also say when infants squeeze their hands or close their knuckles tight, that is also a sign of hunger. Whereas whenever a infant feels satiated, or they're full or satisfied with that after that feeding, their hands will release and they'll become more relaxed. So because breastfeeding or breast milk supply is based on supply and demand, it's important to nurse on one side for as long as the infant wants to make sure they get that hind milk, because remember our hind milk is higher in calories because it's higher in fat content than that fore milk. So if you're not finishing the feeding on one breast, then the infant isn't going to get that hind milk, and it's less likely that they'll be satiated, and they may want to feed again fairly quickly after that feeding. So it's pretty normal for a mom to feed 10 to 12 times per day for newborns. I think a lot of times one barrier is that moms try to get on this strict schedule, but babies will tell you when they're hungry. They're not on a clock. They know what they need, and they will let you know. So I think this is a barrier that a clinician can help with, and just to support the mom and say, I know it's kind of hectic and it may be hard to figure out at first, but you'll be able to learn when your baby's hungry and how to keep them comfortable throughout the day. You just have to kind of get into that routine. Okay, so it's possible that mom may not be able to breastfeed fully to support the weight of the infant. What we see is that weight loss is normal for newborns, and after 2 weeks, the goal is for the baby to get back to their birth weight. So infants can lose up to 7% of their birth weight in that first 5 days. So the goal with breastfeeding is, again, to get them back up to that birth weight within about 2 weeks. Infants who are malnourished tend to be super sleepy, like lethargic, they don't respond, maybe their cry is a little weak, and then they're having less wet diapers. So those are all signs that they're not getting enough breast milk, as well as not having 3 to 4 soiled diapers in a day. So these are things that a doctor is going to look at to see if breast milk production is adequate. So we also know that tooth decay can be a possibility in children who are breastfed. So it's just really important that infants who are 6 months and older should have a dental exam, or 6 months after their first tooth shows, or after 1 year. One of the reasons that this can happen is that if they're feeding frequently at night, that breast milk can pool in the gums and around the teeth, and breast milk has that lactose sugar in it, so that can cause tooth decay. And then finally, we have some supplements that we give to infants who are breastfed. Infants who are exclusively breastfed begin to need vitamin D supplementation at 2 months because what's provided in breast milk just isn't adequate. This is going to be added to formula milk, so infants who are formula fed likely won't need vitamin D. But infants who are born in the United States, like we talked about before, they get that vitamin K injection because their digestive system isn't mature enough to synthesize vitamin K in adequate amounts. Okay, so we've talked a lot about the benefits of breastfeeding, but we've also mentioned some barriers to successful breastfeeding. So these are important to address. We're going to talk a little bit more about some programs that have been established to help support breastfeeding moms on Wednesday, but we're going to go over just a few things today.
Academy of Pediatrics recommends new moms breastfeed their babies for at least the first 6 months. But a new study finds 2/3 of mothers who intend to exclusively breastfeed for 3 months or more aren't meeting their goals. Dr. Kim Giuliano did not take part in the study, but is a pediatrician at Cleveland Clinic Children's Hospital.
One of the factors that they looked at in the study was what contributed to mothers being more successful at breastfeeding. And those babies who were not given pacifiers, were not given formula, and were allowed to nurse within the first hour of birth were much more likely to meet that breastfeeding goal.
Researchers at the Centers for Disease Control and Prevention questioned nearly 1,500 pregnant women. 85% intended to exclusively breastfeed for 3 months or more, but only 32% of moms actually reached the goal. 15% of them gave up before they even left the hospital. Results show mothers who were married or had older children were more successful. Researchers say it may take increased baby-friendly hospital practices, like only giving newborns breast milk in the hospital, to help mothers continue breastfeeding. Dr. Giuliano says it's a team effort.
Moms really need a lot of support in the hospital. They're going to need education, support from lactation consultants, and modifying the environment to make it as fit to breastfeeding as possible. All of the women at the beginning of this study had intended to breastfeed somewhat, and 15% of women had given up before they even left the hospital. So it's really important that hospitals help mothers to reach these breastfeeding goals.
Complete findings for this study are in the journal Pediatrics.
Okay, so again, they brought up baby-friendly hospitals and baby-friendly practices. So we'll talk more about this on Wednesday. I've mentioned WIC a few times. They really help with supporting breastfeeding moms through education and through resources. There's money allocated to provide breastfeeding pumps to moms who are going to breastfeed, and they always encourage moms to breastfeed before trying to use formula. We'll look a little bit more at the WIC website on Wednesday, but just wanted to mention that. The U.S. Surgeon General does have a recommendation along with the World Health Organization to exclusively breastfeed infants for the first 6 months of life. But the goal, again, is to breastfeed up to first year of life. In the United States, our goal is to increase the proportion of infants that are breastfed, as well as the duration that they are breastfed. So we looked a little bit at Healthy People 2020 goals. There's actions identified by the Surgeon General to support breastfeeding. We'll talk more about how that feeds into public policy and laws about breastfeeding, and like specifically moms who are breastfeeding that are working after their maternity leave in general, because all of those can present barriers to continuing breastfeeding up to 6 months or up to a year. But in general, we do see that breastfeeding rates are increasing throughout the United States. Some of the best things that we can do is offer prenatal education. So before mom has given birth, we can teach moms to be about breastfeeding, how to breastfeed. They can see a lactation consultant before they give birth. And all of that can really set the tone and help them create goals that maybe they can stick to by creating some ways that they're going to meet those goals. But we can also offer counselors in support groups, especially to low-income pregnant women with less education, trying to target these groups because we see that breastfeeding among those groups, those rates are much lower. Let's see. So we're going to talk more about lactation support, specifically in hospitals and birthing centers. We'll mention that when we discuss baby-friendly hospitals and lactation consultants on Wednesday. But one of the biggest things that they can do is offer that lactation consultant, offer education and support groups before and after birth, but also having a milk bank is a big thing, a breast milk bank, and not offering formula in the hospital. So we'll look at those baby-friendly hospitals on Wednesday. We'll also discuss lactation support after discharge. But these, I've mentioned this, the barriers that women in the workforce experience after they go back to work. So they may not have a daycare. They may not be close to their infant to be able to breastfeed. They may not have a paid maternity leave or a long enough maternity leave. And that increases their time away from their infant, which again makes it more difficult to breastfeed. Work schedules and lack of support and knowledge by employers, that all can decrease mom's success of breastfeeding as well. So we're going to talk about all of these things. We're going to talk about how the community can help, how workplaces can help, and how public health and public policies can help to support breastfeeding. But again, WIC is one of those great programs that is offered, especially to low-income families and minorities. So they are going to really help to improve the rates of breastfeeding, especially among those groups who are seeing less of that, who aren't breastfeeding as much, and that is only going to help the health of our population as a whole. So we'll talk more about this on Wednesday.